pregnancy and antenatal care, which we come across in our daily clinics. So, presumptions in a pregnant woman. Prior to pregnancy, regular cycles, cycle length 28 days. Hey Siri. Hey Siri. Hey Siri. Day 14 of the cycle, day of ovulation, day of fertilization. That is the assumption. Total duration of a pregnancy is 9 months plus 7 days. That is 40 weeks, 280 days. First day is first day of last menstrual period. 14th day ovulation fertilization, 28th day missed period. Corresponds to 4th week of pregnancy. Fertilization occurs 2 weeks prior. Period of pregnancy gestation, first day of last menstrual period. That is the first day. Fetal age is day of fertilization. Difference between gestational age and fetal age equals to 2 weeks. Because there is 2 weeks difference between first day of last menstrual period and 14th day is ovulation fertilization. So the difference between gestational age and fetal age is 2 weeks. Duration in gestational age, fetal age plus 2 weeks. So duration in gestational age equals to fetal age plus 2 weeks. Example, cardiac activity is positive in 3 weeks after fertilization and 5th week of pregnancy. So when they come in for their checkup, you can use the Doppler and try to hear their heartbeat. Locate the heartbeat. It's heard best on the back of the fetus. Cardiac activity is here heard after 3rd week of fertilization. But heartbeats are not heard after 3 weeks of fertilization. It takes more time to hear it through the Doppler. Trimesters and fetal growth period. Trimesters calculated from first day of last menstrual period. First trimester is 13 weeks plus 6 days. Second, 14 weeks to 27 weeks. Third, 28 weeks to delivery. Also 27 weeks onwards till 32 weeks we can immunize the mom against pertussis to give the antibodies to the baby. 14 weeks to 27 weeks is second trimester. Fetal growth period calculated from the day of fertilization. Period of fertilized ova up to 2 weeks after 2 days of fertilization. Embryonic period. It is called fertilized ova up till 2 weeks after fertilization. It is called fertilized ova. Embryo is called till 8th week. 8th week is 2 months. So up till 2 months it is embryo. Fetal is 9 months up till delivery. 9 months up till delivery is fetal. Note, fetal growth period only pregnancy event not calculated from first day of LMP. How do you calculate EDD? You will have to calculate it, and also you can send for dating ultrasound to find it. Regular 28-day cycle, nothing mentioned. EDD using Naegele's formula, first day of LMP plus 7 days and 9 months. Add 7 days first. Exception, LMP in Feb, add 9 months first, then 7 days. So Naegele's formula is first day of LMP, add 7 days, and then add 9 months. And then if their last LMP is in Feb, then first add 9 months and then add 7 days. Cycle length less or more than 28 days. Calculate approximate EDD using Naegele's formula. Calculate the difference between cycle length and 28 days. Based on cycle length more than 28 days, add the difference to approximate estimated delivery date. Cycle length less than 28 days, subtract the difference from the approximate EDD. Naegele's formula is not applicable in pregnancy due to OCP failure, lactational amenorrhea, irregular cycles, unsure about LMP. Determination of gestational age is done by crown rump length on ultrasound. IVF. Fresh IVF cycle. In vitro fertilization, day 14 of cycle, day of fertilization, day of oocyte retrieval. EDD, day of fertilization plus 266 days. Frozen IVF cycle. Day of fertilization does not correspond to day of oocyte retrieval. Day 3 transfer, day 17 of cycle is equal to date of day 3 transfer plus 263 days. Day 5 transfer is equal to day 19 of the cycle. Date of day 5 transfer plus 261 days. Important terminology and intrauterine death. Preterm pregnancy is less than 37 weeks. Term pregnancy is 37 to 41 weeks plus 6 days. Early term, full term, late term. Early term 37 to 38 plus 6 days. Full term 39 to 40 plus 6 days. Late term 41 to 41 plus 6 days. Post-term pregnancy more than 42 weeks. Abortion, pregnancy loss at less than 20 weeks. Intrauterine death, stillbirth less than 20 weeks is abortion. That's like 5 months, and pregnancy loss at more than 5 months is stillbirth. Classification of preterm. Early preterm and late preterm, most commonly used. Less than 34 weeks is early preterm. Late preterm is 34 to 36 weeks. Extreme preterm babies less than 28 weeks. Intrauterine death, also known as stillbirth, is called when baby is born after 5 months and it is still on birth. Causes idiopathic, most common. Unrecognized IUGR, intrauterine growth retardation, most common single cause. So most of the time we don't know what the reason is. Pregnancy loss when fetal weight is more than 500 grams. Pregnancy loss more than 28 weeks, stillbirth. Those are WHO classifications. Loss of fetal movements more than equal to 32 weeks, modified BPS or NST. Less than 32 weeks, ultrasound. Absence of cardiac activity. Ultrasound shows absence of cardiac activity, Spaulding sign, collapse of fetal skull, overlapping of skull bones. This is the Spaulding sign. Roberts sign, bubbles in great vessels of the fetus. Ball sign, hyperflexion, hyperextension of fetal spine, crowding of the ribs. Amniotic fluid is tobacco juice color. Complication DIC, disseminated coagulopathy. Diffuse risk factor death, fetus retained for more than 1 month. Applied aspect, diagnosed case of IUD, intrauterine death 2 to 3 weeks back. Coagulation profile to be done. Mode of delivery, vaginal delivery is preferred. Spontaneous labor and induction. Indication for C-section is placenta previa, transverse lie, obstructed labor, more than 2 previous C-sections. Obstetric score you'll have to do for your patients. Gravida, number of times a female has conceived. Past plus present pregnancies are included. Parity, number of previous pregnancies that have crossed viability. Present pregnancy is not included. Period of viability, the period beyond which fetus is capable of independent existence. In India, it is 28 weeks. Which is like 8 months. So very important number to remember. Viability is 8 months in India. Measure methods of illustrating gravida, GX, parity, PY, GX, PY plus 2, number of abortions. GTPAL, best method, gravida, parity, A, number of previous term deliveries. B is number of previous preterm deliveries. Number of abortions is C. Number of living children at present is D. Gravida, parity, twins, triplets is counted as 1. Exception is number of living children. Stillbirth, fetal death more than 5 months based on gestational age. Less than 37 weeks is preterm delivery, more than 37 weeks is term delivery. Multipara, female who has given birth more than or equal to 2 times. Grand multipara, more than 5 times. Primigravida, first conception. Elderly primigravida, more than 35 years of age, first conception. Multigravida, conceived more than 2 times. Signs and symptoms of pregnancy. Presumptive symptoms felt by the patient. Definitive, diagnostic, probable, felt by the examiner. Goodell sign, first sign to be positive. 6 weeks of pregnancy, softening of the cervix, that is Goodell sign. Piscasek sign, 8 weeks, asymmetrical enlargement of uterus due to eccentric implantation. Osiander sign, 8 weeks, again 2 months. Pulsations felt in the lateral fornix of vagina due to increased uterine blood flow. Chadwick sign or Jacobi sign for again 8 weeks. Bluish discoloration of cervix and vagina. Palmer sign 8 weeks. Rhythmic uterine contractions. Hagar sign 6 to 10 weeks. Bimanual palpation of vagina and abdominal fingers approximate each other due to isthmus plus empty and soft in the early pregnancy. People just send them to the ultrasound. Definitive signs, positive signs. Gestational sac with yolk sac and fetal poles on ultrasound. Positive cardiac activity. Fetal heart sound on auscultation. Fetal parts felt on examination. Pseudocyesis, false pregnancy. Patient presumes fakes pregnancy. Definitive signs are absent. Fetal skeleton positive on X-ray, definite sign. Presumptive symptoms. Symptoms of first trimester. First trimester is up to how many weeks? First trimester is first day of last menstrual period up till almost 14 weeks. So till 14 weeks is the first trimester. Okay, so symptoms in the first trimester. Amenorrhea due to increased progesterone. Morning sickness. Nausea plus vomiting due to HCG. We also test HCG to confirm pregnancy in the blood. When it's high, it means the patient is pregnant. Urinary frequency. Growing uterus irritates bladder. Increased frequency. And breast tenderness. Other symptoms: quickening, breast changes, increased pigmentation. Size of uterus. Period of gestation comparable to 6 to 8 weeks up till 2 months, pear. 8 weeks, orange. 8 to 10 weeks, orange. 10 to 12 weeks, grapefruit. Height of uterus increased by 1 centimeter per week after 4th week of pregnancy. Pelvic organ at 12 weeks, height of uterus equals to pubis symphysis. So 12 weeks is 3 months. Second trimester. So that is 14 weeks up till 27 weeks. Nausea and vomiting subside. Minimum levels of HCG at more than equal to 16 weeks. Decreased urinary frequencies. Uterus becomes an abdominal organ. Quickening, first sensation of fetal movement by the mother in the second trimester. Primigravida 18 to 20 weeks. It's earlier in multigravida 16 to 18 weeks. Braxton Hicks contractions onset 16 weeks, that is 4 months near term. Painless uterine contraction does not lead to cervical dilatation. Note, true labor pains are painful and lead to dilatation of the cervix. Fetal heart sound. Handheld Doppler after 10 weeks and stethoscope after 20 weeks. Handheld Doppler 10 weeks. So it just like a probe. Just put jelly on the stomach and try to locate the heartbeat and where it is maximum, and then it calculates the heart rate for you. If you are unable to find the heart rate, then you have to send them to ultrasound immediately. Stethoscope after 20 weeks. So 10 weeks is 2.5 months. So after 10 weeks of gestation, you can use Doppler to find the fetal heart sound. Internal ballotment. Head of baby pushed up per vaginally. Head strikes opposite end of the uterus and returns to touch examiner's finger, seen by 16 week. Baby pushed from one side per abdomen, strikes palm of opposite hands and returns. External ballotment, seen by 20 weeks. Cutaneous changes plus breast changes prominent in second trimester. Linea nigeria. Stria gravidarum. Cloasma, third trimester. Symptoms during third trimester. Increased urinary frequency due to irritation of bladder by fetal head. Respiratory discomfort, increase uterine height, diaphragm pushed up, increased breathlessness. Pedal edema due to pressure on gravid uterus. Backache. Height of uterus. Pubic symphysis. It reaches, as we learned before, at 12 weeks. Then at lower border of umbilicus at 20 weeks. Then at xiphisternum at 28 weeks. And no, at xiphisternum at 36 weeks. This is what you have to remember. 12 weeks, pubic symphysis. Lower level of umbilicus 20 weeks. Xiphisternum 36 weeks. At 36 weeks, complaint of excessive breathlessness. Head of baby descends into pelvis. Height of uterus decreases. After 30 and at 40 weeks, height of uterus decreases. Comes at 32 weeks and relief from respiratory difficulties. Lightning welcome sign. Parameters: fetal head on per abdominal examination. Felt at 40 weeks, not felt at 32 weeks. Flanks empty, 32 weeks, full at 40 weeks. Shelving absent, 32 weeks, present 40 weeks. Fundal height in centimeters equals to period of gestation in weeks. If it does not correspond, next step is ultrasound. Discrepancy of 3 weeks, 3 centimeter, pathological cause. Applied aspects. Height of uterus is more than period of gestation. Full bladder, wrong dates, polyhydramnios, twin pregnancy, molar pregnancy, concealed variety of abruptia, macrosomia, intrauterine fibroid. Height of uterus is less than gestation. Wrong dates, intrauterine growth retardation,